Southeast Minnesota counties are trying to find new ways to look after people in crisis after a recent policy change by Mayo Clinic is scaling back the civil commitment cases the hospital is willing to take on. KIMT News 3's Evan Berg is joining us live from 2nd Street Southeast, across from the Mayo building in downtown. And Evan, how is the county adjusting to the change?
Nick, it's been a bit of an adjustment for the county and for local law enforcement. But Michael Boehm with the county's Adult and Family Services say the county is making that adjustment. Boehm says civil commitments help physicians, the county, and other local authorities keep those who may be dangerous to themselves or others off the streets until a place can be found for them in a state facility. This includes cases of severe mental health issues, developmental disabilities, and drug addiction. Mayo Clinic said in a statement they are still helping in some of these cases, but it is scaling back who will be eligible for a stay at the clinic, focusing on those with immediate medical needs and excluding those who have no physical need for long-term inpatient care. Boehm says this mostly affects commitments involving drug addiction.
Doing the best we can to assure their safety and the safety of the community has meant more visits to the community, connecting with them, checking in with them, often trying to encourage them to go to treatment of some sort that they need. Sometimes they're willing, sometimes they're not willing.
Mayo Clinic said in a statement this decision was made to protect patients, staff, and the Mayo community as a whole. In that statement it said, quote, "Mayo Clinic in Rochester remains in compliance with Minnesota law and only admits to the hospital patients who have medical needs that are appropriate for an inpatient care setting. It's not in the best interest of individuals who are involuntarily detained to remain in an inpatient hospital setting without a medical need," unquote. The county says it's continuing to work with Mayo as it undergoes this transition. Live in Rochester, Evan Berg, KIMT News 3.
All right, thank you, Evan. And Boehm says he hopes the increase in need to find places to house civil commitments will encourage the state to address ongoing bed shortages at state mental health and addiction facilities.